So in this video, I want to talk about some of the best options for low back pain. Sometimes people will come in and tell me that another provider has recommended pain pills, muscle relaxers, or even needle injections. And the problem with those options is that they're really just band-aids to cover up the symptom. They don't actually fix the underlying cause. That's really what we work on, is the underlying cause, so that we can fix the problem and make sure that it doesn't come back. So let's start by looking at the anatomy of the low back. So what I have here is basically a motor unit. So in your low back, you have 5 lumbar vertebrae. This is 2 of them. And then you have a disc in between. And you can see we have the spinal cord that comes down from your head and brain, down your back. And then we have the nerve root that comes and exits basically behind the disc and in between the vertebrae. So what can happen is usually we have a combination of acute and chronic stresses that add up and take their toll over our lifetime. Those could be things like the way we sit at our desk, the way we sleep, the way we exercise, do housework or yard work. Those things add up. And then you add on top of that the more acute things like, a car accident, falling off a bike when we were a kid, maybe slipping and falling on ice, athletic injuries. All of these things take a toll, right? And just think of it like a cavity, right? This cavity doesn't happen in just one instance, right? It takes time and repetition, maybe years or decades for that cavity to develop. And the same thing is true with our spine. It takes time and repetition to develop, and it also takes time to fix. When the nerve and disc are affected, we can experience a large variety of symptoms. It can be something as simple as, sore, achy back pain. The pain might get really, really sharp. We might get muscle spasms. We get pain down the leg like sciatica. We might notice numbness, tingling, or weakness in the legs even, possibly digestive problems, and even reproductive problems, all because there's an issue in the low back. And I'll tell you what's most likely not causing your symptoms, and that's a strained muscle. Strained muscle is a symptom in itself. It's not the cause. The underlying cause is what controls the muscle, and that's the nerve, and that's what we work on. We get the spine moving better so the nerves can send the proper signal to the muscles and help your body work better. So the best way to treat low back pain is a combination of chiropractic adjustments, spinal decompression therapy, as well as strengthening exercises. The adjustments get the spine moving better, help those nerves work better, and send signals properly. The decompression pulls on the spine, takes pressure off the disc, and allows it to heal. The exercises help strengthen and stabilize the spine and really support those adjustments. So if you have any questions or need anything, feel free to give us a call, and we look forward to helping you feel your best.